Hey 3DMJers, this is Andrea Valdez and you are listening to the 3D Muscle Journey podcast. I'm just popping in here to do a quick intro on behalf of Alberto Nunez and Eric Helms, as they are currently busy in New York watching Jeff Alberts and a few of our other athletes competing at the WNBF World Championships while I'm recording this all for you today. So in this very important episode that you're about to hear, Alberto and Eric will be speaking to Nick Licamelli about all the ways in which your aches and pains and bodily feedback can be handled and cared for throughout your lifting career. Nick is our team's injury reduction and management specialist. He is a physical therapist. You've probably heard him here on the show before. And he will give you a fresh perspective on how you really can care for yourself and take charge of your own health when various types of pain set in for various reasons. The guys will be discussing how a lot of false narratives have worked their way into the medical field, why we are led to think that doctors always have the answers, and what you can do to protect yourself from wasting a lot of time and money in an often broken healthcare system. Nick has legitimately changed our team for the better, having done one-on-one Skype calls with almost every one of us coaches about our own personal injuries, and we're so happy to share his insight and perspectives with our athletes and podcast listeners as well. Please do yourself a favor and listen to this in its entirety. Please share this with your friends, and please feel free to contact Nick using Instagram or his email, which you can find in the show notes or on our About page at 3dmusclejourney.com. And while you're there, don't forget to leave feedback or comments on this episode at our website. Or you can go to youtube.com/team3dmj and leave us whatever you want under podcast number 139. Here is our episode titled You Are Not Broken with Eric Helms, Alberto Nunez, and Nick Licamelli.
What is up, 3DMJers? We've got a treat. We have Dr. Nick Licamelli on the line to answer all your questions about STDs. Wrong podcast episode. We decided on a different topic. We're actually going to be talking about recovery strategies and all the wacky, crazy stuff that we see athletes do, that some of us have done, that I've done, and that have evolved over the years, whether that is dry needling, acupuncture, cryotherapy, massage, magnets, crystals, praying to specific gods, and in my case, making a deal with specific demons to have better recovery so I can compete in strength sport, and other seances and types of voodoo, rearranging the innards of chickens, and anything else you might have heard of related to recovery, just the standard stuff, really. So I've also got on the line with me Alberto Nunez, and I think in this specific conversation, the only reason it's not just Nick monologuing is A, that's boring, but the main function that myself and Alberto play is we're probably the two most injured members of the 3DMJ coaching team, so that we have the most personal experience in the trenches, being the people who might utilize some of these methods. But Nick is the expert here. So Nick, say hello.
Hello, everybody. Thank you guys for having me on. Always a pleasure. Looking forward to this one. It should be fun.
And Berto, how's the SI joint doing these days?
Better than ever, man. It's I never thought I'd be able to enjoy lifting the way I currently am. So I feel very fortunate when it comes to that, and I do my best to keep it that way. So no new injuries in my 30s, which I'm very proud of, because I'm almost out of 30s. So we're doing well.
Wow, that's impressive. Because you're into your 30s. I think as we were just discussing off air, you and I are at the tail end of the mid 30s as 36-year-olds. Another year, we're going to be in our late 30s. And we all know what happens when you're in your late 30s. Everything.
What happens? Oh, man.
Everything.
Okay.
All goes downhill. Well, if you're Jeff Alberts, you finally win a pro card. So maybe we got some good things coming on my future. So, Berto, I'm assuming that the reason why you haven't been injured in the last 6 years and why your SI joint's doing the best you have is because you've been regularly getting spinal adjustments.
Oh man, don't get me started with that. We have so many like nutty dudes in this town when it comes to that. Um, yeah, so I will make it a point to share this podcast because it's the trendy thing to do, and people spend so much money sometimes out of pocket when it comes to this sort of stuff. Um, but to me, I think the biggest thing when it comes to like just staying healthy has been the best way to like fix a problem is to not have one. So I am a lot more realistic about what it is that I can't handle, and I'm careful when it comes to um, when it comes to the exercise selection, like things that don't fit, but maybe they're traditional. I'll put those off to the side, or maybe only do so of that. And yeah, in terms of technique, we've gotten a lot better as well. Eric got to see me lift in my 20s, and I was a weight room cowboy, man. So that's been the big thing. Is just like, hey, let's not have any more problems. Even if you have to like leave this workout like halfway through, that's way better than having 3 months where you're working around something. So no, all is good in my hood, man, or my SI.
I'm glad to hear it, dude. So it sounds like you have not been partaking in any of these specific strategies that we're going to be talking about. So I don't understand how you're healthy and not injured, but I'm assuming it's something to do with either genetics or drugs. So anyway, let's actually get to me not joking and talk about something serious. So Nick, the reason I want to talk to you about this is because as a academic, I have the ability to read research that is from a multidisciplinary field. Fun things I've been doing lately has actually been reading geology papers because my wife's doing her master's on geology, and occasionally she'll have a question about the general academic process of publication and how to find things, how to do a meta-analysis or review, et cetera, et cetera. But anyway, there are definite differences between fields, but there's definite similarities in how things are published. But it's difficult to assess certain aspects like the efficacy when you don't understand the root physiology, or when you don't understand or you're not familiar with the way that publishing is done. And one thing that I've seen and I've read about a bit in the areas of, like, say, research on acupuncture or dry needling or massage or physical therapy in general is that the research designs are often lacking some things. Kind of the same can be said of sports science, but it also seems like there is a surprisingly large amount of research that seems suspect to me, and it seems like it's definitely got some inherent built-in biases, and I just don't know how well. Like, if I look at a meta-analysis on these different strategies, I don't know how well to trust the results when a bunch of them are, say, for example, something I saw was that there's never been a negative finding on acupuncture that's come out of China. And that just seems suspect to me, like that's probably not accurate. And it makes you wonder how much bias is going into that. And I don't have the expertise to know what the mechanisms are or how reliable the research is. So I'm always a little unsure of my ability to assess this stuff. So first, I guess I want to ask you, what would you make of the evidence-based practice in your field of physical therapy? How good is the research, and how new is this whole thing of using research to assess the methods that are used in physical therapy or chiropractics or musculoskeletal rehab in general?
Yeah, so right off the bat, so we all have our own biases, right? So my inherent biases are that I always lean more toward exercise, more of an active approach to treatment. I want to get the person active. I want them to be in charge of their own care. So I'm always leaning more toward that when I'm diving into this stuff. But as far as the physical therapy as a profession, the idea of us being the practitioner of choice or the first entry point to the healthcare system is relatively new. We didn't have in the past what's called direct access, where someone can come in off the street and be treated by us. Usually they would have to have a prescription from an MD. So those, and then they changed the degree to a doctorate. I don't really know. I don't know. It's nice to have the title, but I think I don't think it's super important that we're now called doctors. I think it's just the natural progression of the profession.
It does make you a better person if you can be called the doctor, though.
Right. Yeah. I mean, besides that.
I mean, that's just how I feel about it. For no particular reason.
And now when I write my name, I can write Dr. Nick, and then after it, all my credentials. Mm-hmm. And then at the end, did I mention doctor?
Correct. If you put the doctor in the front, and then in my case, the PhD afterwards, or in your case, the DPT, it's kind of like a pre and post workout meal. It makes your whole name more anabolic. You just got to really, front and back load it. I'm going to keep letting you talk, though. I'm going to be quiet. So go ahead.
So the idea of us being evidence-based practitioners is pretty new as far as the profession goes, and I think it's tough because the evidence is, like you're saying, is not always the best. You can have a meta-analysis, systematic review made up of garbage, and it's just going to be a big pile of garbage. You ever see the movie The Big Short?
Yes.
When he's explaining the bonds, and he says, well, this is like cat poop, and this is like dog poop, and this is like dog poop wrapped in cat poop.
Yeah.
That's basically what we're getting at sometimes. And there are one of the concepts, I think, where we kind of fall into a bad place is, and Eric, you mentioned this in a podcast, in the Iron Culture podcast, and the idea of something with utility, but we don't quite know or have the right explanation for it. So we observe things like massage, or things like foam rolling or acupuncture or cupping, and we observe that it helps decrease pain, or maybe it makes the muscle looser, whatever that means, and you have some more range of motion, you feel less stiff. So we have that observation, and there's some utility to that. In the short term, you can reduce some pain, you could increase your range of motion, feel a little bit less stiff. The problem then is when we try to attach an explanation to that. And then we take that explanation and we make continuing education courses. And then we create mentors for that, so that new grads come into the profession, and then they get taught by their mentors. And when you're a new grad, you don't really question the mentors all the time. So then it just keeps kind of filing down. And then before you know it, it's kind of infecting the whole profession. It's kind of like if I were standing on one side of a room and I asked you to close your eyes. I went to the other side of the room, told you to open your eyes. And I said, do you know what? I actually hovered above the ground and flew to the side of the room. You have no way of knowing whether or not that's true, but you have no reason to not believe me, right? So all you know are the facts, is that I was on one side of the room and now I'm on the other side. So now if I go make a continuing education course about how to fly across the room, we start to get these things that we see work, but the mechanisms aren't quite there yet, and then we get false narratives attached to that.
For sure. So I think I just want to talk about some of my experiences over the years, and I'm a naturally skeptical person. I would love to say that I learned it completely through my education, but I would say it's probably the other way with the chicken or the egg. I probably was drawn to empiricism because that was my natural tendency. My mom tells a story of, she lost me at a magic show one time. She found me because I was on the side of the stage looking behind the curtain trying to figure out how the magic was happening, and I was I think 6 or something like that. So like my bias going into things has always been, if I can't open my eyes and understand how you got from one side of the room to the other, I'm not buying it. So I have probably lost out on the placebo effect many a time, which is unfortunate because it's powerful. But I'll start with one that's always been in my head and made me go, what, is when a massage therapist, after they finish, and I like massage, I still get massages. There's actually good evidence to support massages from some high quality data. If you do it post workout, it does seem to improve time to performance coming back. So not knocking massage. However, some of the proposed mechanisms that you hear from massage therapists, the shit massage therapists say sometimes makes it difficult for me to want to go back to the same massage therapist, even though like I just had a good massage, but the way they describe it bothers me. So, hey, make sure you have some water after this massage because it's going to clear out the toxins. And I wonder, what did you do with your hands to me that now I have toxins in my body? And I think you should clean your hands and not massage my open wounds because I don't know. I don't know what happened. Or the concept of actually mechanically changing my tissue by rubbing on it. That makes, like, you think about it, like, oh my God, can you imagine if someone untrained gave you a massage and like permanently changed your muscle shape or function because you could just be rubbed? They're like, am I made of clay? I'm confused, So I totally get what you're saying with people. You see a result and the result isn't fake. That's a real thing, but the mechanism by which it happens, we don't fully understand. And I think it's easy to go, well, it doesn't really matter. If it works, it works. But one thing that I think is really important is that this is just like supplements. Like if you attribute your success to a supplement rather than to exercise or to nutrition, you're actually losing out on self-efficacy. It's more like, I don't have the power to change myself. I've got to take this pill. Likewise, if truly what someone needs is to do specific exercise and lifestyle change, thinking that they just have to go to this magic hand or needle or, whatever, witch doctor type of magic person, like it's adjustments or whatever, that's the key to fixing me. That also doesn't encourage them to necessarily adopt that lifestyle. So I think there is some harm in having these false narratives. I also understand there's a difference between a false narrative that's just repeated a lot or people attempting to explain something that works and maybe not getting it right. And so one thing I do want to clarify, I have definitely gone to physios, physical therapists, chiropractors, and massage therapists over the years who, when I ask them, why are we doing this or how does it work? They go, we don't really fully understand it, but it does seem to have this effect. I've had positive experiences here. Here are the potential explanations of why it could work. That I really appreciate. And it doesn't even, for me, it actually gives me more confidence in the person. I don't know about you guys, but I personally really appreciate when the practitioner is honest and says, I don't know, but this does seem to work. It could be simply a reflex response, but hey, we can try it. If it doesn't work, we'll go to something else. And I don't know, do you think that's the best way to approach it? Like, how do you deal with, in the clinic, how do you talk to people about these potential strategies or tools that we don't know? Maybe that they seem to work, but we don't know why.
It's difficult. It is difficult. And also you have to take into account that my job is to help the person in front of me. So that person, I can sit here and talk about how pain is multifactorial and it's not, everyone is individual. And so I can't say that and then not take the person's expectations into account. So if someone comes in and, they heard somewhere that this certain treatment is going to help them, do my best to educate them, say this is how we, the understanding we have about it now. And as long as sometimes I think we have to put a little bit of chocolate sauce on our broccoli. And I kind of made a post about this not too long ago. And if your goal is for the child to eat the piece of broccoli, to get the nutrients in the broccoli, if you put a little bit of chocolate on it, they're still going to eat it. They're going to get the nutrients just with a little bit extra, right? So if I go to a restaurant and I'm not a foodie, right? Don't know much about.
Well, you're clearly not a foodie because you're not putting chocolate on broccoli. You could put cheese on broccoli, get the same effect, and it actually would taste good. I'm just saying.
So I don't know, like, right, I don't know the proper pairings of food and how to cook things or different wines to eat, right? If I go into a restaurant and I say, I want a filet mignon well done with a glass of white wine, I'm sure there are people that are pulling their hair out. And maybe the chef even says to himself, like, that's ridiculous. Like, I'm not doing that. That's not right. It's not the best way to do it. But the chef's job is to make my experience the best possible experience it could be. So as long as he's not doing harm to me, as long as he's not giving me a piece of raw chicken, right, that's going to harm me, he's got to bend a little bit, right? He can make suggestions, but if that's how I like my steak, I think he has to bend a little bit, even though it's not what he usually does or what he knows to be best. So I have those conversations a lot, and as long as I'm not giving a false narrative, as long as I'm not saying that this joint manipulation is going to realign your spine, I'm okay with doing those as long as the important things are in place. So as long as we spend majority of our time going through graded exercise and graded exposure and progressive overload, as long as those things are in place, I don't mind adding in a little bit of toppings if that's the expectation. And a lot of times, after one or two visits with those things, they start to realize, like, well, if it's not really helping, like, do we even have to do it? No, we don't have to do it today if you don't want. And then they kind of start to realize that, okay, what's going to help me in the long term is more of this active stuff, and that joint manipulation feels good, but maybe we could spend our time, better other places. The other thing with, like you were saying about the kind of realigning joints and things like that, it's the evidence really shows that we are not great at palpation, right? So we aren't very good at palpating one segment of the spine from another. So to say that we are focusing on one spot or one joint is stiff and we want to kind of influence that joint and move it, is crazy, right? So how my hands going to realign your spine, right? It's crazy. So it's almost like, and you hear like stiffness, right, or tightness, but we have no way to measure that. We have no way. We have no normal for tightness. We have no normal for stiffness. It's different for everyone. It's not like a thermometer, right? Like water boils at the same temperature anywhere on the face of the earth. It's not like that. Everyone is different. So one person may be tighter than someone else. So not only is the way that we're measuring it not doing the job, right, but with our hands trying to measure tightness or stiffness, that's not only not doing the job. Even if we had an instrument to properly measure tightness, we don't know what good tightness is. And then the treatment for that also isn't doing it. So it's kind of like we're just throwing all these things at it with all these different narratives. And the worst case is when people get dependent on it. And then all of a sudden they wake up and they feel that one side is off or their hips are uneven. And then they feel dependent on you. I've had people plenty of times that have seen other physical therapists or other professionals, and they come in and they just say, yeah, you got to just check my hips. I feel off today. Oh, okay. They feel off. Okay. Let me fix that for you. But with those people, they may have a good relationship with that practitioner. So it's a conversation, and I'll say, okay, let me take a look at the hips, and I'll look at them and say, okay, looks like they're actually okay today. Why don't we get going with some of the strengthening, and then we'll come back to that later if we have to. So I'm not ever making anyone feel stupid, because I don't know all the answers. Things could change, right? I just am going off of what I know best now, and part of the reason why I'm so passionate about this stuff is that I was there. Like, I've been there. I've come out of school and I've done these things. I've done, I've had those conversations with people where I told them that I was adjusting their hips and oh, you're tight here, so let's release this muscle and we'll strengthen this muscle. And very similar to our journeys in bodybuilding. I mean, we have been in the muscle magazines, we've gone down that road, and now that we've kind of found a better way, we look back on that and we want to help others realize that that's, there's a better way. So the journeys in bodybuilding and physical therapy for me have been very similar. I don't know what you asked me to start that conversation, but
I think it was convoluted anyway. So I was just glad you started talking because I just needed to stop. So that was a really good answer to whatever I asked.
So I don't obviously this is what Nick does, but when like a fellow gym rat comes to me with like one of these issues and they tell me what they're doing, I guess the way I try to explain it to them is that you don't want to be like that person that will ask you during the holidays, so what do you eat? And they want to simplify everything that you're doing to do what you're doing, and they want it like in 2 minutes flat. When the truth is, like, man, it's gonna take some learning. You're gonna have to invest some of your time when it comes to that, and then also you're going to have to get your hands dirty a little bit. And when I hear something like someone like Nick say that, to me, it just makes me feel so much more, because I've been in that position too, where it's like I've gotten good massages from people, or I've been to a chiro that makes me feel better. But every once in a while, like, he'll say something, I'm like, damn it, dude. Like, up until that point, like, we were having a great time here and I was sold. But something like, I don't know how this works, but or you're gonna have to do your share of the work, or else next time you're in here, I will be able to notice that you haven't. Like, to me, especially to the committed bodybuilder, I think that just seems to be the solution when it comes to a lot of things. Like, whether it's like, taking care of your body, whether it's like finances, it's like, hey, no, it's not like go invest your money in this stock and like you'll be good for the rest of your life. It's like you're gonna have to learn about the subject at hand and invest some of your time, unfortunately. But that's half the fun in a way.
Yeah, that's 100% true. And a lot of it is the expectation coming into it. So a lot of times, we're looking for that quick fix, right? Not us, but people are looking for that quick fix. Just like with bodybuilding, like you're saying, like, oh, so what do you eat? Like, oh man, like, what do I eat? That's not where we're gonna start.
Yeah.
And then you'll see, like, once. So I don't get angry when I hear that, because I got to test the waters, right? So someone will say something like that, and my first knee-jerk reaction is, all right, this is an opportunity to learn, right? So I'll kind of test the waters and dip my foot in and kind of see, like, talk about the complexity of pain and how maybe your back pain isn't just because your disc is herniated and the jelly's squirting out in your spine. Maybe it's this and that, and pain is actually kind of interesting. It's multifactorial, and it could be more. And then if you could tell when someone's paying attention, or when they're like, all right, man, like, I just want to know, like, are you going to fix me? Just like with bodybuilding, like, all right, man, like, are you going to tell me, like, the right diet or what? Like, just get to the point. So that's the challenging part. Something that we're so passionate about sometimes, I think, falls on deaf ears. The expectations, I think, coming in have a lot to do with it.
So let's get down to brass tacks a little bit. It sounds like what I'm hearing is that there's not a whole lot of evidence to support the use of some of these treatment strategies, but some of them do seem to work, at least on an individual level, at least in some temporary period. But I think let's define what work is in that context. So what is the limits of what, let's just start with what we were already talking about, joint manipulation. So we're not really sure so we say out of alignment, but we don't know what your alignment should be. And it's probably not a static thing. Obviously we adapt to things. We don't know that we're actually adjusting the target joint, but we do know that people seem to feel better afterwards. Not everyone. I actually don't feel better after I get adjustments. is joint manipulation good for anything? And are there cases in which it might be helpful? And if it is good for anything, why?
So I do use joint manipulation, and there's certain circumstances. So if someone comes in and they're just like lit up and they're in pain, like they're hobbling in, and we try a couple different things, we try this, we try that, just not having it today. By me doing a joint manipulation that takes 4.5 seconds to set up and perform, if that helps them get out of some pain in the short term, I'm good with that. I'll do it every time. As long as I preface it with, look, what I'm doing here is kind of like a Control-Alt-Delete to the system. I'm not readjusting your back. I'm not going to kind of do anything other than relieve some pain, some tightness in the short term. It's kind of a global decrease in muscle tone, and has some non-specific effects. As long as they understand that, I'm okay with doing it. And then that will help us kind of get into our exercise and be able to tolerate more. So I think that is probably the only time that I would use it, is if all else fails, we can't get to the important stuff because it's just preventing them from moving correctly today. It's just a bad day. They woke up with their back all tight, and as long as, like I said, as long as I give them the proper explanation, I'm okay with doing it. I think the problem is when these things are used and those explanations aren't given. So like taping or cupping and things like that. Yeah, it could definitely help in the short term, but I think it's the narratives that come with it, and then the dependency on those things that comes with it.
Okay. So why is a joint manipulation like a Control-Alt-Delete? What is happening?
We don't know. We don't know. We just know that it is a non-specific global decrease in muscle tone.
So okay, interesting. So by manipulating a joint, we're seeing a change in muscle tone, which is, I think a lot of people are thinking that manipulating the joint, they're changing the joint in some way. And they are, but it's because of the muscles tugging on it and leaving it in a different position for a period of time.
Yeah, and if we were to say that it did something to a joint, we'd have to be able to measure it accurately beforehand and measure it accurately after. And we just don't have that type of tool to do that with our hands anyway. Right.
So to me, this kind of maybe goes back to the nature of pain. So pain has like feed forward and feed backward mechanisms to it, such that when you're in pain, it then influences function. And something that could be biomedical is affecting and causing pain. So it could be protective, or it could be just your I think, as you put it on Iron Culture, your car alarm's going off not because someone's breaking into your car, but because, a dog ran by and bumped into it, or because a truck went by that shook the ground. So I guess if perception leads to a pain response, and that perception is based on something that is not necessarily, well, I guess it doesn't even matter, and then you change perception by altering the joint mechanics, it can potentially kind of reset that car alarm. And then if, that may at least allow you to do something, get them to be able to move. So it almost allows them, I guess, to access something else. Is there instances where you do that, like do some type of analgesic based treatment to then get them to be able to move so you can make your exercise more effective?
Right. Yeah. But so that also, I think, can be done through graded exercise as well. So that patient I was talking about who's just completely lit up today, it can't move, it's just not having it today. That person, I think you start with more of a passive modality or a passive treatment, and then you get into more of the active stuff. But for the most part, majority of people that come in, whether it's their symptoms are exacerbated that day, whether it's a great day, I'm always pretty much able to modify their exercises, downgrade or upgrade. There's always something I feel like I can do to kind of load that tissue in some way, depending on how they're presenting. And then that loading of the tissue also has an analgesic effect, but it's active, and they're kind of going through their motions, whether it be a squat, if it's a painful squat, and we have to make it kind of a quarter squat today. at least we're doing that quarter squat, and then as we kind of start grooving that movement, maybe we get it lower and lower and lower. And not once did they feel like they were broken, or did they feel like they were out of alignment, or that they were dependent on me in order to do that squat. And that's the name of the game. Like, whenever we can let them show them what they can do rather than what's wrong with them or what's off about them or how we can fix them. Whenever we can kind of show them what they can do, that's the best thing.
That makes a lot of sense. It gives them tools on their own, and it makes them feel like they're not dependent on your office being open, or like, I'm broken right now and I need your magic hands to fix me. I think there's a lot of gold there from a self-efficacy building standpoint, even beyond the mechanisms or which methods do and don't work.
Yeah. And the thing with the big joke is that when you come out of physical therapy school, you don't know everything that's wrong with you until you go to PT school. So you leave school and your tibias aren't rotating correctly, and your scapula isn't moving in the right pattern, and your neck is forward because you've been studying and you're on your phone all day, and you come out of physical therapy school, like, every time you take a step, you just imagine everything like not working correctly every time you take a step. I know that feeling. Like, I know that feeling of going into the gym and overthinking every single movement, and my foot, I'm not dorsiflexing here, I'm shifting my weight here, and my knee is moving here, and it really is fatiguing, and it makes you quite dependent on these adjustments or these treatments. And like I said before, like, because I know what that feels like, that's why I'm so passionate about this stuff, because the best thing I can hear from someone is how was your weekend? Oh, it was good. My back flared up a little bit on Saturday, but I think it was just because I was raking a lot of leaves in the yard. So then I just took some rest that night, woke up the next morning and kind of just walked it out, and it felt better. That's beautiful. Like, great. Like, your back hurt a little bit because you increased your activity. So back off a little bit, let it heal itself. You're not broken. You don't need me to adjust you. You weren't out of alignment. You don't need me to tape you. You don't need electric stim. Like, you did it on your own. Like, great job. Now let's get back on track and keep exercising and keep loading the tissue. And that's the best feeling, is when when you see it working, and you see them kind of taking ownership of it, and you really see it sinking in. The problem is that that's not how the healthcare system is set up. The healthcare system reimburses for treatment, not for, hey, good job, you did it on your own. So that's why I think
they should give you an affiliate code, so that, like, you're every time someone gets out of pain, they just, like, put that in there, and, like, you have your own little code, and then you'll be good.
Yeah. So it's a system that is built on the amount of treatment you can give. So naturally, we're going to be incentivized to give more treatment, which sometimes isn't the best thing. And so I think it's coming from both ends. I think patients are coming in with expectations from social media, from the mass media, from daytime TV, and then I think the healthcare system is getting us from the other end with incentivizing us for more treatment. That's all changing, by the way. It's changing like crazy. This is a crazy, crazy time in healthcare, at least in the U.S. But it should be interesting to see how it looks in the next couple of years. It's not gonna be the same. Things are changing. Reimbursement is changing. So I think we're starting to catch on a little bit, and we're kind of being forced to find other ways to measure progress and kind of prevent this overutilization kind of incentives.
Right.
Hey everybody, it's Eric Helms. Thanks for tuning into our podcast. As you know, at 3DMJ we promote evidence-based approaches to the lifting community. If that's something you want to dive deeper into, I'd encourage you to check out my research review, Monthly Applications in Strength Sport, or for short, MASS. This is a review that myself, Dr. Mike Zerdos, and Greg Knuckles put out every month. We cover the latest research publications that are applicable to strength and physique athletes, or anyone who's looking to get stronger or improve their body comp. Our content is in both written and video format. For more information on how to subscribe, check out 3dmusclejourney.com/mass. That's 3dmusclejourney.com/MASS for further details. Thanks for tuning in.
It's interesting.
I've got a question.
Oh, go ahead. Go for it, Berto.
Yeah. Just because everything that you just described, Nick, kind of, I guess, it sounds like what I know of the chiropractic world. You know, I've only been to a chiro maybe like 3 times, and it's left me pretty skeptical. And other people who, you know, we share similar perspectives. They've had similar experiences. So what does a chiropractor do at this point, especially with folks like you running around? Like, what is their scope of practice? How can they help you?
Well, I think it comes down to just empowering the patients, and so the scariest people are not the ones that know better but do wrong. The scariest ones are the ones that don't know they're doing wrong, and they do it thinking they're doing good. So I don't think chiropractors or physical therapists are out there being greedy and doing things that they know don't work and making money hand over fist. And I don't think that's the case. I think it's just a lack of knowledge. I think once you get into the field, yes, continuing education is required, but I think if you get to choose your own continuing education, you're going to naturally just choose the sources that kind of give you a nice little bias hug, and then you don't ever kind of branch out. What I found for me was connecting with like Clinical Athlete with Quinn, and Level Up Initiative, and PT Inquest, and all these different sources that are like-minded and think like that. Not like-minded in the sense that it becomes an echo chamber, which it does sometimes, but we always question, right? So everyone thinks everyone is like-minded, but within that like-mindedness, there's questioning, and there's always reaching out and trying to understand different perspectives. So I don't think that necessarily the healthcare practitioners are out there to get over on people. I just think they don't know better. But it forces us then to deliver care in other ways. So whether that's a cash-based system or whether it's through telehealth online, which is what I've kind of been diving into now, just because I've seen a need for it, and I feel like I can have more of a reach, and educate and help along the path a little bit. So did that answer the question? I don't know.
Yeah. It was, no, you did a good job with that. I guess the only thing is, like, so what does a chiropractor do? Like, I guess when I think of chiropractors, like, I've never been assigned exercises by one personally. I don't know a whole lot of people who have one who's like, that's what that's the brunt of their treatment.
Yeah, so I can't really speak to exactly what a chiropractor does, because I haven't really like dove into their practice act and never have been to a chiropractor. But as I understand it, they are more impairment based. So like they will help you get out of pain, whereas a physical therapist will incorporate more exercise. And so as I understand it, that's kind of what they do. But again, I've met chiropractors that will have the same conversation I'm having with you, and they'll emphasize exercise and refer out to proper, the right people and stuff like that. So I think it really depends on the person. I mean, I would go to a good chiropractor over a certain physical therapist any day. I think there's people, like-minded people in all professions.
And I ask because usually that's where the person goes, like when they're in pain, like they just, threw out their back. Like that's the first thing they think of. It's like, who am I going to go see tomorrow? I'm going to, go through Google and go find a chiropractor. So
is that because chiropractors had direct access before physical therapists?
It could be. I also think chiropractors do a heck of a job marketing themselves. From what I understand, you walk into a chiropractor's office and they have the white coat. They're Dr. So-and-so. Nice to meet you. Whereas a physical therapist, you walk in, I have a button-down shirt. Hey, I'm Nick. Come on in. Like, I think it's a little bit different the way that the public views chiropractors versus physical therapists.
You have to kick a stability ball out of the way to get to your office.
Yeah, exactly.
What is this? I got to exercise? Come on. Yeah.
And but one of the things I hear often, and again, I'm not lumping all chiropractors like into one. There's great chiropractors that I would send my own mother to, but is sometimes I'll hear, I have a great chiropractor. I love the guy. I feel great. I've been going to him for 10 years.
Mm-hmm.
And I say, okay, well, in my mind, I'm saying, all right, if you're going to someone for 10 years to help you with pain, is that working? Like, or is it just like short term? Okay, short term. Okay, short. Like that's not the kind of treatment I would seek out if I have to do something for 10 years and keep going continuously. Like, but I think it's also the narratives that they're given. I think throughout their day they get out of alignment, so they have to go back. They have to be readjusted. They have to go back. They have to be readjusted. So I guess they just kind of feel like their skeletons are getting off and they need to be put back in, and too bad for everyone that doesn't have access to a chiropractor like they have, because they're walking around all crooked.
Can you imagine a time before chiropractors when people just turned into crabs and rolled around? But I think, I have met chiropractors from various, literally different schools of thought. It's interesting because there's, as I understand it, and Nick, just correct me if I'm wrong here, there's a lot of overlapping scope of practice between physical therapists, chiropractors, and then if you get outside of the United States, physiotherapists, osteotherapists, which have different roles in different countries, mean different things in different places. And I think it can be quite confusing to someone who's just looking for help as to whether or not they should go to a musculoskeletal specialist who's an MD, whether they should go to a physical therapist, whether they should go to a chiropractor, or whether they should go to a massage therapist even. I think it all just kind of gets lumped together in the same picture in someone's mind who's not well educated in that. So I think Berto's question is probably one that many people have. It's just like, well, who should I go to, why, and what's the differences? I think generally is what Berto's asking. So I think that would be helpful just for our audience to understand a little more about.
Yeah, it's a great question. And sometimes being in the field, you forget about that stuff. But yeah, so I don't think there's a right answer to that. I think you have to find the right person, not the right profession. Mm-hmm. So one of the guys who I learned a ton from, Dr. Michael Ray with Barbell Medicine, he's a chiropractor. And you hear him talk on podcasts, and he's written unbelievable pieces, and he'll be the first one to say the same things that I'm saying about some chiropractors and some physical therapists. So I think it depends on the person, and I think if you kind of do your homework and find someone that has some experience in the things that you are in your goals. So if you're a high level dancer, I wouldn't go to me, for example, right? I could do a decent job, but I've never competed in dancing at a high level, or I've never, if you do horseback riding, there are physical therapists out there that all they do is ride horses. So I could, find someone who specializes in that. Then like your clients, a lot of times they would find themselves going to their local practitioner, and that person may not know exactly what it takes to be a bodybuilder, a weightlifter, a powerlifter. So what you guys are doing is you're bringing me on because I have experience in that. So I think it depends on the person. And I think it comes down to doing your homework and finding the right person, and things like online telehealth. I think that's really lowering the boundary of entry to these things. We're not limited to our geographical area anymore. It's a crazy time in healthcare, and access is getting easier and easier, not only to learn or to educate yourself, but also to get professional advice, without boundaries. So I guess the short answer is I wouldn't recommend a certain profession. I wouldn't say go to a physical therapist every time. I wouldn't say go to an orthopedic all the time, or a chiropractor, or massage therapist. If I would say find someone who's specialized or has experience in what you're doing, and go from there.
And probably someone who kind of embodies some of the things we were talking about, like not doing so not convinced, because I don't think they're lying most of the time. I think it is, like we talk about, being incentivized by the way the healthcare system is, and that's why they're bringing you back in like you're some kind of fish that's on a hook. But I think what's actually happening is the healthcare system produces things like maintenance chiropractic, or I need you to see me every week, or something like that. And because that is what is done, it is therefore rationalized on the back end as that's what needs to occur, rather than let me figure out a way to game the system to get all the money. So I think when you're forced to do something, you want to convince yourself that it's the right thing, because you don't want to be forced to do something that's not necessarily harmful, or at the very least expensive to the person or the system. So
right. And hey, some of the stuff works, right? Mm-hmm. It's not like you're not seeing results. You may have less pain, so you may not ever question it.
That's a really good point. Yeah. So speaking of what works, I think, like Berto, I have questions as well. Like, out of all those different external treatment modalities where it's not being taught how to do appropriate graded exercise at the right pace and the right type, and that's specific to your needs, are there any of these external treatment modalities that do have decent evidence, that do what they purport to do? Or at least show consistent evidence of efficacy, even if they don't do it the way we think or thought commonly it is done?
So it's tough to say, because we're lumping a lot of different modalities like into one. But things like foam rolling, we'll take foam rolling, kind of blew up, and different, like the Theragun thing that it acts like a jigsaw, right? I see that all over the place too. I mean, look, if you feel better after you foam roll, there's some evidence that doing some kind of stretching with some deep breathing and foam rolling before bed, it can kind of wind you down a little bit. Can you get the same effect by just lying down in a quiet room and just focusing on your breathing and meditating? Probably. But if a foam roller forces you to do that, then by all means, I don't think it's gonna hurt. Like, if you like to foam roll, just know that you're not breaking up adhesions, you're not breaking up scar tissue. What you're doing is you're causing that non-specific global decrease in muscle tone, and it kind of takes you out of your day, right? So if you're wake up in the morning, have your coffee, rush to work, have a rough day at work, come home, go to the gym, and then come home, eat dinner, and then you would otherwise just kind of go into bed and start your day again the next day. If a foam roller causes you to stop and just focus on your breathing and focus on internally what you're feeling on your leg as you're rolling, I think there's merit to that. I think there's some positive to that. So yeah, I think sometimes they have utility if you have the time for it. I don't think it's necessary. I wouldn't say there's any external modality that is absolutely necessary. So yeah, I think sometimes they could work as long as you have the right narratives to it. But I don't think anything would be necessary to.
Well, yeah, not even necessary. Just which ones might have independent utility and don't necessarily have a replacement, like that meditation couldn't get the same out of. Is there anything that you're aware of that people should be considering, or that's interesting at the very least?
I don't think so. There's nothing that's jumping to mind that I can really think of.
How dare you not give me a quick fix?
I mean, what if the question was packaged about bodybuilding? Like, what's the one food that that should be in every bodybuilder's diet?
Protein.
I don't know. Protein. Right, but it's kind of like that. Like you can get some people that say, oh, you got to have sweet potatoes to draw out the fluid, or you have to have this, or you can't have chickpeas, or right? I mean, I think it's a very similar question and similar thinking. I think can tilapia versus steak help? Of course, right? Because it's not as calorically dense. But is it because of the makeup of tilapia versus the makeup of steak? No. So I don't think they're, those. I think it's. I wouldn't say that there's anything that's jumping out that is yeah.
Yeah, but that's interesting, because we actually were able to drill down to, here's the magical proposed solution, and here's where there might actually be a difference. And it almost seems like there's not that level of understanding yet in some of these treatment modalities in the bodywork world. Like, I could sit here and talk about how, the iron, the micronutrient and macronutrient content of steak versus tilapia are different. And how, they have different digestion times and things like that. And you could talk about how they would differently affect the body. But when I hear someone talk about dry needling or trigger points or foam rolling even, it seems like we're still at that stage where people will, even well-educated people, they won't really be able to drill down to the mechanism. Like someone might propose tilapia because it thins the skin. They'll say what it does. They can't explain why, or why you shouldn't have steak, or something like that. And then we can go, well, hold on. That the whole paradigm of thought there, the root problem of that way of thinking is that specific foods have magical properties, rather than foods have nutrients have effects, and sometimes they have combined effects that are better than isolated nutrients. Then we have to think about the interdependence. That's kind of the more nuanced explanation, and I can often now look at some of the bodybuilding, the voodoo wisdom, and go, they were wrong about why, but they were actually observing something. Like you just mentioned how, when I switch to fish, I get leaner. Well, you just cut out 20 grams of fat per day. So I think that would be useful for people to understand is, all right, we're talking a lot of shit about all these modalities, and we just basically said that none of the individual modalities really does anything specific or unique. That's different than saying, hey, steak has a different macronutrient profile than tilapia. So what is the underlying misconception related to all these different modalities? How do we arm someone with the appropriate tools to think about these so that they are not necessarily wasting time or money, or at the very least they know why it works, so that they don't think something inaccurate about their body? So I think I used to have a view, even with my education level and knowledge and skepticism, that I think I saw my body as more mechanical. Like my joints could wear down, not like they're constantly adapting, or that there was one way to move. I thought of things as a much more kind of almost like I'm a robot, which was not actually the case. And then if I could affect tissue mechanics, it would change other things. And I think that isn't even an assumption I was aware of, but it made me look for tissue-specific answers to why some of these things worked, and not maybe central mechanisms. So anyway, that was a convoluted question, but hopefully it's something you can help with.
Yeah, so that's a great point and great question. So think about that feeling when you realize that you didn't have to eat every 2 to 3 hours, or you didn't have to slam a protein shake after your training, or right after your training. Think about that feeling when you realized that and you actually adapted it into your life, how freeing that felt, right? It's like you look at the world completely differently. You just feel like you have so much freedom, and you're not always thinking about food or thinking about where your next meal is going to come from, because you have to preserve your muscle from eating itself. Same thing with, like, you're talking about how you looked at your body very mechanically. I did the same exact thing. Like you look at yourself very mechanically, and you think there's a right way to move. And if you don't move that way, well, heck, if my hips are too tight, I can't get into that squat like that, so I'm going to hurt myself. And but then once you kind of change your thinking to what we're talking about now, how there really is no right way to move. Like I mean, I think that's on a spectrum. Like there are some things that you should always keep in mind when you're under a loaded bar, but for the most part, like there's no right way to move, or where your joints aren't wearing down every time you take a step. It's not like you have like a tank and it's just getting more empty every time you wake up in the morning and put your feet on the ground. That same freeing feeling is happening once you kind of understand these concepts. And yeah, it's just very, very limiting to think how most people are taught. And then as far as the mechanisms behind these things, so take something like a medication, like a blood pressure medication. And Quinn has used this analogy. I've heard him use it, the blood pressure medication. So if you, there's a problem, they're at high blood pressure. So we want to figure out how to lower it. There is a group of scientists who are breaking down at the cell level or at the chemical level. They're finding things that interact with each other to cause one thing, which then causes another thing, which causes another thing, which causes another reaction, which eventually lowers your blood pressure. And then once they have those mechanisms set, then they come out with this medication, and then they test it and test it and test it, and then they finally get to the people. Something like foam rolling, that process doesn't happen. You roll on a piece of foam, and you get the response you want, right? So it's like you take take something, and your blood pressure gets lowered. Now we try to figure out why that happened. It's mixed up. So we find things that work, and then we try to prove it. And we don't always prove it, and then that's where these false narratives come from, because they're just speculations. So I think it's important to realize that if we wouldn't do it with something like medicine or surgery, right? We wouldn't, if we had to get a surgery on our disc between L4 and L5, we wouldn't want a physical therapist to palpate our backs and say, yeah, that's L4, L5, let's go in and do it, right? You wouldn't trust that. But for some reason, we trust it when we do a quote-unquote specific segment mobilization, or we're impacting the body. We want to adjust or rotate a certain segment. We trust that they're touching the right spot, but we wouldn't want them to do surgery on that spot, right? So if we are actually doing those things, like why would you trust it? Why wouldn't we be doing these like mobilizations like under like functional MRI or like an X-ray, where we can actually see where we're doing it if we are having that much of a specific effect? So I think the problem is that we don't have that stepwise approach like something like a medication. We don't know the mechanisms first. We know that it works, and then we try to backpedal and figure out, okay, why does that work now? And that's kind of where we're at with a lot of these things.
Mm-hmm. It makes a lot of sense. And it does seem like, because this stuff's been around for forever, like the history of acupuncture, massage, acupressure, moving certain ways, that goes so far back. And that's exactly how you'd approach a problem when you didn't have the scientific method is, I've got this place where I feel tight or pain or pressure. Let me try pushing on. All right, that didn't work. Let me make it hot. All right, let me make it cold. All right, I'm gonna stick a needle in it. And then for some people, those do or don't work. And I think now, and correct me if I'm wrong, we're starting to understand that because pain is a multifaceted experience that results in a sensation that therefore then inhibits our movement potentially. If we can, and I think when you talk about pain being an experience, it's easy for people to think, oh, it's all in your head, and think that gives us more agency over it than it really does. Like you can't actually just think away pain. You can get distracted, but a lot of it's not under our conscious control. But if we can alter the sensory experience, sometimes, like you said, it kind of controls and it deletes it. And like I've experienced, so for example, I think off air, I think we were off air. I was talking about how I've had dry needling, and I don't really like it. I don't feel like it helps me long term. But what I do notice is that if I have a tight area, a quote unquote trigger point, and someone dry needles it, it does relax and it stays relaxed, and that can be nice. Doesn't make my elbow tendonitis go away the next day or even when I go train that same day, but at least I don't have like a really tight forearm. So I got that going for me. So clearly something happens. And it does seem to, I think the control delete's a really good analogy. And yeah, that's really interesting just to know that we can somehow affect either the feed backward or the feed forward, nervous system output to then therefore change the pain experience by doing something external. I think that is a really useful piece of information to know, because then we can go, okay, well, how could that be used? But having the old narratives, I think that's just why, like, it's kind of this ever expanding card deck of, we go from massage to cupping to needles to heat to cold to, because if we're constantly thinking it is something about us changing the tissue locally and not realizing that it's having some effect on the way the nervous system is changing the pain experience, then we're just going to keep hunting for the next way to manipulate the tissue. And when you really think about it, like, do we want to actually be able to do that? Like, there was a really cool paper about, like, basically said, hey, what if it's true that foam rolling actually was changing the tissue mechanics? Like, A, that would take like 1 ton of pressure, and B, it would permanently damage your tissue and like tear your fascia and tendon. Like, you don't want that. You don't want to be able to roll your muscle to the point where it actually changes the fascia. That's not good. So that's I think that's an important perspective. And I guess that's what I was getting at. Like, when I talk to, it's impossible for me to explain to someone all the different mechanisms, physiology. I don't even know it all, and reasons why they shouldn't take 100 different supplements, because that there are at least that many that I can think of off the top of my head that don't work, and a handful that do. It's much easier for me to explain to them how effective a supplement can be, and how it is in relation to the importance of, say, nutrition and training. So I guess if I was if you want to arm people with the right critical thinking skills, so that they don't just keep going down these rabbit holes of trying new tissue manipulation stuff, like, what do they need to understand?
So that's a great question. I think it comes down to understanding what pain is. So like you're saying, it's multifactorial. For those who don't know, recent research has been kind of coming out. Well, not recent, but it's kind of getting more well known that pain is more, I guess, multifactorial is the best way to describe it, meaning that it's not necessarily related to tissue damage. So the amount of pain you're feeling is not necessarily related to the amount of tissue damage that you have. Now, this doesn't pertain to everyone. If someone rolls their ankle and their ankle blows up like a balloon, that's not an experience. That's tissue damage causing that response, right? If someone blows out their ACL on a football field, same thing, right? This is tissue damage. But within that, the pain experience can be different, right? So if I roll my ankle off a curb trying to save my daughter from getting hit by a car, I can be 100% sure that I'm not going to feel my ligament tear in my ankle, right? Because my environment is different. So if my environment can change my pain experience, that's just more proof that pain is not necessarily 1 + 1 = 2, right? There's something that's happening in between the tissue damage and then my perception of pain. And then the way that we can combat that is by gradually exposing ourselves to that edge of discomfort, right? So analogy I've used often is a pirate ship, right? So if you're the first mate sees lights in the distance and he runs and tells the captain that there's something out in the distance, and now the captain has to make a choice, right? So his choice is going to be influenced by his past experiences, the way he was raised, his biases coming into sailing the ship. If he just watched a movie about pirates, if his Aunt Mary at Christmas talks about her experiences with pirates every year, and he has these thoughts and beliefs, he may call everyone on the ship to load the cannons, get ready for battle, right? And then when they pass the light, it turns out to be a lighthouse. He had a response to a certain stimulus that was not appropriate because of his own past beliefs and because of the environment that he happened to be in. Now, if he happens to know those waters, if he's been there before and he knows that they're safe, he may not even think twice about it, right? But that captain who was fearful, the way to help him would be to gradually expose him to that light. So maybe he realizes it's a lighthouse, and then if it happens again the next day, maybe he only tells half the sailors to man the cannons, right? And then you keep getting closer and closer to that lighthouse, and he keeps realizing, hey, it's okay to be. It's not necessarily danger, right? Nothing is happening, and then before, after a while, he would be able to pass that light and not have that pain. So that is kind of the core of kind of getting at this thing called pain, and it's finding that painful movement, and then grooving that movement, going to that edge of discomfort with whatever it is, whether it's changing the depth of a squat, or whether it's changing your frequency, changing your volume, changing your RPE, changing the load, changing your foot position, changing your movement pattern, right? So we just said before, there's no right or wrong movement pattern, but if you alter your form a little bit and it feels better, then that's a different way to load the tissue, right? So we're still getting that training effect, but we're not provoking that pain. So then eventually we keep gradually exposing the body to that edge of discomfort, and eventually that will get kind of get back to normal. The problem is that process I just explained is way less sexy than something like what we're talking about. So it's like, Berta, like we were talking about before, the person that asks you at a holiday dinner, like, so what do you eat? It's like, oh, so what do I do for my back? I'm not going to, how do I have that conversation? Like, so back to coming kind of full circle here is that's the problem with all this stuff. At the root of it, it's not that, yeah, some people are making money off of it and people aren't getting better for the long term. Those are all bad things. But I think the most toxic thing is that we're guiding people in the wrong direction. We're guiding people to think incorrectly about their pain. These things affect physical structures, right? Physical tissues. We're adjusting joints. We're releasing muscle tissue. It's all tissue equals pain. And that's kind of the opposite of the empowering message that we want to send, which is, hey, you're in pain. It's okay. You're not broken. We're going to get through this. Like, how is your sleep? Are you stressed? Like, talk to me, like, get to know me. Majority of my evaluations on the first day are me just talking to the person. If someone tells me that they can't pick up their 2-year-old off the floor because their back hurts, I don't make a note and say, okay, what number 0 to 10 is your pain? I say, wow, that must be, how does that make you feel? Like, that must be difficult. I have a daughter of my own and I'm always moving around, and how does that, how does that really affect your life? And so I think it comes down to that therapeutic alliance, building that with the patients, and using that moving forward. And then that also brings to mind the whole 0 to 10 pain scale, right? So what's your pain 0 to 10? What's your pain 0 to 10? It's almost like, and I've said the metaphor also before, is like you just go through a bad breakup and you spend 2 weeks on the couch eating Haagen-Dazs, and then you finally get out of the house.
Personally, but yeah.
Ben and Jerry's. Finally get out of the house, and you're hanging out with your friends, and the first thing everyone says is, oh, how you doing? How have you been doing? Have you talked to her? I think I saw her on Instagram. Like, she's been going here. And you're just like, all right, like, I just got out. I don't want to be thinking about this. So a lot of times I don't even ask about pain. I don't say, okay, what's your pain today? Because pain is this moving target. All right. So it's not a great measure for things. And if someone comes into me, I don't see myself or my job as getting rid of pain. If someone comes into me with the goal of getting rid of pain, I usually say, I understand, that you want to get rid of this pain. However, if your pain is a 4 out of 10 today, and you can do a quarter squat with 4 out of 10 pain, and then in 3 weeks, you're able to do a deep squat with some weight on your back, but you still have a 4 out of 10 pain, is that a win or is that a loss? In my book, that's a win. We're doing way more. But pain, when pain is the metric that we're using to measure our progress, it's difficult because, like we're saying, it is so multifactorial, and it's kind of like a moving target to try to measure progress. So that's the kind of educating that I like to do. I like to kind of set that from the get-go to realize, like, I understand you're in pain, but we're going to try to get you back to your life. We're going to get you back to bowling. We're going to get you back to playing tennis, right? Or in the gym, right? Like, it's easier in the gym because it's very controlled, and we can modify different things, and it's easily measured with weight or with reps, or, hey, I did another set today without pain. So it's easier to see those little wins in the gym. A little bit more difficult with someone who maybe doesn't go to the gym or has just a 9-to-5 job. But so, yeah, I guess the point is that we have to get that message across, where pain is not necessarily a tissue damage. You have everything you need with some guidance to help yourself. And the problem with these things that we're talking about, these quick fix modalities, is that it reinforces the opposite of that.
Makes a lot of sense, man. One thing I've really benefited from this, because I think there's the initial response I had to understanding how multifaceted pain was shit. I don't know anything about this stuff. Because believe it or not, my master's was actually on my first master's was on injury prevention and performance enhancement. So I took multiple classes that were all based on kind of the NASM model from the mid 2000s, kind of like, hey, if you have a tight muscle here and then a weak muscle here, you strengthen that one, you release this one, you fix dysfunction. By the way, there's coupling between, the glute and the contralateral lat. And, if you have upper cross syndrome or whatever, it was very, very kind of, I would say, late 90s, early 2000s PT. I don't want to say dogma, but the current paradigm at the time influenced that. And then I could explain all this stuff and connect dots in A, B, and C based on, if you spend too much time being seated, that lengthens these muscles, weakens those. Then you go try to squat, and that's why you hurt. It's actually, your synergists are working too hard, not your prime movers, and that's why you tore your hamstring because you sit too much or something like that. And it's frustrating because I had it all explained in my head, and I had a master's degree to support it. I think it's over there. And then the more I started to learn and read, I went like, shit, I don't know anything. Like I'm just going to say I have a master's in exercise science because that's the overarching degree. I don't know how to prevent injury or deal with it. And so it was I felt like I'd lost a bunch of tools, but then did you really lose tools when they didn't work in the first place? So I didn't really, but that's how I felt. And now actually understanding more and getting kind of the exposure to folks like yourself, Quinn, the guys at Barbell Medicine, and understanding this a little more has actually been empowering to me after I had my neck injury last year. So the kind of the narrative I told myself, based in reality, was that I don't know when my neck's going to go. And after getting, MRI and x-rays done, oh shit, I have a pretty jacked up neck. But then learning how the surgical interventions are not any better than just waiting, how 70% of them resolve in 6 months. And understanding that it's not just like, okay, my neck is worn down, it's mechanically destroyed, and if I do anything, it's going to just make it worse, that it is going to heal itself, that the tissue resects and all that stuff, and that not every time I feel off in my neck doesn't mean there's been disc damage, but I am just hyper aware of my neck now because of that injury. Like, okay, well, I can, now I know when I'm in pain, that could be related to something or not, and that probably tells me how far I can or should push it, but it doesn't mean I can never overhead press again. So it encouraged me to start getting back into overhead pressing. And I've actually been doing that since like 6 months now. and doing it in a controlled fashion in movements and planes and positions that typically don't cause pain, and also not letting that pain become catastrophized or really really freak me out. But I mean, it wasn't like there wasn't tissue damage. I did have, loss of 60% of my strength on my right side, and I had to keep, my arm up, and I had, imaging done. So like there was tissue damage, but it doesn't mean that pain is always indicative of that. And that kind of freed me up, that understanding, to start doing that graded exposure. And I'm actually the strongest overhead I've ever been now, like as in currently. So that's cool. So I guess I just wanted to provide my little case study of even someone who was on the other side of that understanding of the way we think injuries work and how to treat them and address them, as a quote unquote injury prevention specialist myself, not actually having been one, and then moving from being injured to not, and then getting the benefit of kind of this better narrative. It did take time, but I would say probably the same reason Berto is now squatting again over 4 plates and actually hit a 500-pound squat. And the reason why I'm overhead pressing near body weight for the first time in my career is probably because we've kind of taken these graded exercise exposure approaches versus kind of going up. This movement is totally off limits for me, instead of thinking of how to modify it.
Well, and the way Nick framed pain, it just, to me, it's silly almost to like want to have a life without pain. Like pain and discomfort is like they guide you, right? And you learn from them, and they tell you a lot. And that was like with my whole SI joint issue. It's like, dude, when you're healthy and things are going well, like pain's always kind of guiding you anyways. Like when you're doing a leg press and you're somewhere in the like 15 to 20 rep range, like what I'm feeling, like it's feedback for me. I don't see it as a negative thing. Say like someone who just started lifting yesterday and they're like, ouch, I stop when it ouches for the first time. So like pain's already a part of your life. And when it comes to other things too, like, hey, the Haagen-Dazs on the couch, right? Things like that. Like we learn from that. We regenerate, we come back stronger. It makes us more cautious and all that. And the same thing with my back. When I finally decided, you know what, I think I'm gonna try to squat and I'm gonna take what's there. And that example, like with the quarter squat, like it was perfect. That's literally how the whole scheme went. It's like, yeah, you're hurting, but like how many good days have you had like the last 6 months, and framing it that way and taking today's pain or the trends and trying to make sense of that. It's helped me get to this point today. And yeah, it all starts with like, like pain's not necessarily a bad thing. It's confusing sometimes, but it guides you, I feel.
Definitely. And I think I couldn't have said it better myself, man. And pain is just a sensation, right? It's like hunger. It's like thirst. We just feel pain. And like we're saying, sometimes it isn't always the right feeling. Like if I go eat breakfast and then an hour later I walk past, I don't know, a donut shop and I smell the pastries and I feel hunger. But that doesn't mean that I'm starving to death, right? It's just a feeling. It's the feeling of hunger. Just like pain. Pain isn't always, like we're saying, pain isn't always a bad thing. And you can learn from it, just like you're saying. And you don't learn things anyway, as in my experience, you don't learn as much when things are going well. You learn when things are going crappy. And I told you I wasn't going to use marriage, but I'm going to.
Here we go,
right?
folks. Get your hate mail ready.
Yeah. I've learned more about my wife. I've learned more about myself when in hard times than good times, right? When you are going through something and you're forced to dig deep and find out, why do I feel these feelings? Why am I saying this? Why are you saying it? Those are the times when you learn the most, right, about yourself. And same thing with injury and pain. You learn the most about your body when you're forced to start doing things that maybe you weren't used to doing, or start thinking things that you didn't really have to ever think about. And this whole conversation obviously is with without any red flags, right? So if you're having like ripping numbness down your leg, I don't want you to think, all right, I'm going to go to the gym and try some quarter squats, or like, yeah, I'm okay. Like Nick says, just go like, take it easy and it's all in my head, and just go get a massage and I'll be good. Like, if you do have pain, obviously this goes without saying, go see a professional, go get it checked out. rule out red flags. Loss of bowel and bladder, extreme weakness in a leg or in an arm, obviously chest pain, stuff like that. Those things you want to get checked out. And it doesn't always work. Like this stuff that we're talking about, in an ideal world, it would work every time. It doesn't work all the time. Like nothing works all the time. So sometimes things like a steroid injection could help, right? So it wouldn't be my first go-to. It's an external, kind of quote unquote quick fix thing, and it's not active. But if we're trying the graded exposure thing and we're loading the tissue and man, it's just not getting better and we're on point with our sleep, and all right, you know what? Why don't we stop hitting ourselves, into the wall and try going for the injection, see how it feels. And sometimes that little decrease in inflammation will help jumpstart the whole process, and that will do the trick. So I'm not, I don't want to give off that this is the fix for everyone and it never fails and this is the way it is and everything else is stupid and we don't need anyone else in the healthcare system and in this whole corrupt healthcare system. It's not like that. Everyone is different, and there are cases that it works beautifully. There are cases where it just doesn't work, and that's where it's the judgment of the professional to kind of refer out where necessary, or reach out and kind of point them in the right direction when necessary.
Yeah, I mean, there's a time and a place for surgery. There's a time and a place for drugs. Like even chronic. So I think, and like you said, just because pain isn't always directly related to tissue damage doesn't mean tissue damage doesn't cause pain. You roll your ankle while you're saving your daughter, you don't feel anything, but get your daughter out of the way, you turn around, oh shit, your ankle's going to start hurting. That was exactly what I experienced when I got that, what ended up being a very minor bicep tear in my first comp. Is I wasn't feeling pain anywhere in my whole body while doing the stone lifts, which is cool. It's good to know. And that's also something I noticed in powerlifting meets back when I was, before I got FAI surgery, which for me was a very successful intervention. I know it's not always, but I had a very clear anatomical block. And when I was competing in powerlifting, I would be able to get through my squats, and my deadlifts and my bench, and the whole day I'd feel no pain. But then within maybe 30 minutes after finishing the powerlifting meet, I was limping and I couldn't move and I was messed up for days and I couldn't train right. And it just made me wonder, well, how did I do my third squat if I was like, I can't even squat right now, let alone squat 495, So it was, that was an interesting experience there, just to know how the experience can be altered at different times for different periods of time for different reasons and in different contexts. But I still did have, tissue damage. I still had a labrum tear, So it's, I think, hopefully no one's hearing us and saying that we're poo-pooing the potential underlying physiological cause for the pain. Just that experience can be modified, can be temporary, can be unrelated to at least its magnitude, severity, or time you experience. It can be unrelated to a change in the actual physiology.
Yep. And Eric, you said it before, and I'm just going to say it again. We're not saying pain is in your head. We're not saying you're making it up, right? And we just want to reiterate that because that's not what we're saying at all.
Yeah, that's a good point. I mean, I would love if it was, because then you could just, psychology away the pain. I think pain is a perception, right? And we just like a bodybuilder can deny their perception of hunger to the point of getting shredded, they're still fucking starving. They still experience a lot of hunger. It doesn't go away, even though it doesn't become a limiting factor to their strength, or sorry, to their ability to get in shape necessarily. And I think that's kind of what you're talking about. Like, hey, you might always have a little bit of hip pain, but you can still squat. You can still get stronger, and you might be able to manage that pain so that it's something you can find acceptance with. And that's kind of the same thing. Like, acceptance is such a powerful tool. We use that for our bodybuilders. Like, can you accept the fact that you're going to be hungry most of the time? And if so, great, you can get shredded. And I think there's a lot of, on the other side of the fence, powerlifters who have accepted that if they want to keep getting stronger and compete in Masters 1 and just keep pushing it, and they've had a few dings and injuries over the years, that they're going to be in pain sometimes. But if they can keep getting stronger and it's not debilitating, they're okay with that, you know? And I think there are some people in the world who have a narrative that that means chronic injury or debilitation, or that once you sign up to do a powerlifting meet and then you decide to compete in it long term, you've signed a deal with the devil. Like, I'll get really strong, but I'm going to be broken one day. And I don't know if that's necessarily true. You probably will sustain a serious injury related to powerlifting, but I don't know many people in their 50s and 60s who haven't sustained a serious injury from life or related to being, sedentary. I mean, there's people who are so sedentary they have to get their foot cut off, like, so I think it's just it's a very useful difference in perspective.
Yeah, and I never made that connection before, and that's a really interesting way to look at it. So going through a contest prep, you can do everything in your power, put a lot of time and effort into not feeling hungry. You can manipulate all kind of low calorie foods or calorie free, or whatever that means, but load up your diet on things that to fight hunger, just like you can kind of go through your life or go through your sport and try to never feel pain. But is that worth it? Like, acceptance, Eric, it's the perfect word. Like, can we just accept, all right, we're going to do this thing and we're going to be hungry as we prep? Or can we just accept, like, hey, pain is just a sensation, and we feel pain. Human beings feel pain. So can we accept that we're going to have pain sometimes? I think that I never made that connection before. That's a really good point.
Well, thank you. And I would even go so far to say is I've met people who focus on their pain so much that it becomes worse. Just like we have met many competitors who focus so much on trying to manage hunger that it becomes a new problem. The fact that you're eating 4 pounds of broccoli is now an issue. It's making it harder to get to where you want to be. While you initially started eating lots of broccoli to try to make hunger better, but that there is a sweet spot to where you have the appropriate level of acceptance, but you're also using a few modalities that help. Like there's a decent appetite suppressants out there that are in supplemental form that you might take and not eat 4 pounds of broccoli. Maybe you just have one bowl of broccoli. That might be the sweet spot to where hunger is at that place where you can accept that level of hunger, or keep it going so you can get into shape. And I think that's kind of, I guess, what you need to be focusing on is not going, I shouldn't be feeling any hunger or I shouldn't be feeling any pain, but I need to get to the place where I have a manageable level of hunger to get the job done or a manageable level of pain to get the job done. And in the end, it's the same thing. For a bodybuilder or a powerlifter, it's about performance. Can you get stronger? And is it worth it? And is it fun? And is it enjoyable? And is it making your life better? Can you get into better shape and be better on the platform? And all those same things. And so it doesn't mean that you ignore hunger. It doesn't mean that you ignore pain, because you can't really. And doing so causes a new host of problems. But it's more so, how do you get to the point where you can manage these sensations to actually get the performance job done?
And sometimes I see it where people view their pain in a way where it almost becomes their identity. Mm-hmm. So I'm the person with the bad back, or I got bad knees because I played football in high school, and it's just it becomes their identity. So it's hard to change that mindset. When the first thing someone says to me after I say, "So what brings you in today?" "Oh, I've had bad knees my whole life. The doctor said I got the knees of an 80-year-old." It's like, all right, this is a little bit deeper here. This is, this person's identity. Part of their identity is that they're in pain. And sometimes I've heard of, thank God I don't have any personal experience with this, but sometimes people who recover from cancer, they have that sense of like, well, the cancer is gone. That used to be my identity. And there's like this weird, like, negative feeling about saying goodbye to it, or even pregnancy. Like you have this, you identify with carrying this child, and after it's over, you put so much into that identity that it's kind of kind of interesting how that happens sometimes.
Yeah, I often remind myself that we are animals, and that we are animals with a really well-developed, prefrontal cortex that causes additional problems. Like when I see an animal limping, I know it's actually probably hurt,
Yeah.
But when I see a human limping, I think they may have really enjoyed the movie Shaft, or they might, like you said, have an attachment to having like an old hip injury or something like that. So there's multiple reasons that someone could be showing signs of an injury that aren't the injury. But yeah, like when you deal with animals, like they respond to the physiological. I mean, I guess it's possible, like if they've had the exact same injury before, it could be false, but it's not because of fear or the same kind of. It's not because of catastrophization like it is in a human, for sure.
That's a good point. Yeah. That's why I'm not a vet.
What? No. You said like my dogs, when they get hurt, it's so different. Like they forget and then they jump off things, and I'm trying to catch them. And I'm like, we were doing okay all day, and then you decide to jump off the bed. Whereas with myself, when something hurts, I'm like, it becomes a slippery slope where I'm like, well, I'm not going to be able to squat next week. And then the next 3 weeks are just going to suck, and it's going to impact this and that. And yeah, so it becomes a much bigger issue than let's just manage what we can right now,
Mm-hmm. And in my personal experience as a pet owner, like, animals bounce back so quick from self-sustained injuries or fights or things that they experience out there. When they have trouble, it's when they get surgery, right? Because they were asleep while it happened. It's hopefully the appropriate intervention, but it's not something that they're adapted to. Like, I think animals are really great at naturally doing a graded exposure to whatever, and then they bounce back like within days. Like, animals it's insane. But when they get a surgery and they're like, no, you need to let this heal and let it be immobilized for whatever reason because we did something pretty funky you're not even aware of, that's when you have to put the ridiculous cones on dogs or cast their legs and all that stuff that we see. Because, like you said, it's outside of their realm of expertise, and they'll hurt themselves. So that's kind of just an interesting consequence of having that little different thing than us strange apes, So yeah. So anyway, I think Nick, I guess this is a good point where we've kind of talked ourselves back to the starting point. Is there anything that we have not covered that you want to bring up before we wrap things up?
I don't think so. I think we really touched a lot of good points. I think the main message here is that we shouldn't view pain necessarily as a bad thing that needs fixing all the time. Pain doesn't equal tissue damage, and sometimes it can be a slippery slope with some of these external modalities that promise to impact at the tissue level, at the joint level. They may feel better in the short term, and by all means, if it feels better and you enjoy it and it's not hurting you, go for it. But just keep in mind that pain is multifactorial, and most of the time you're not broken, with a little bit of guidance, with some graded exercise, that's, you have the power to help yourself most of the time. If you do have pain, go see a healthcare practitioner, rule out red flags before we even get into this conversation. And yeah, I think that's probably the best takeaway here.
Awesome. I think that's a really good summary. I think you've armed people to know that all these different modalities out there, they may or may not act as a useful control delete for you, but it doesn't necessarily mean that they are modifying things at the tissue level. You probably don't want to do that even if you could. And if you want to seek out a practitioner, it doesn't matter whether they have DC after their name, DPT, or if they're a physio or whatever, you probably want someone who's open to things and doesn't believe in a tissue mechanic remodeling kind of impact of these things. Like, if they know what they're doing, they're probably going to use those modalities in a more effective way and not lose the opportunity cost of helping you do exercise in a graded exposure and fashion that they may have more experience than with you. So I think anyway, I just really appreciate the conversation. I know it's still something that I'm learning more about. It's outside of my expertise, and it's helped me personally as an athlete, and I'm sure it will help the listeners. So really appreciate your time, Nick.
Of course, always a pleasure, guys.
Thank you, Nick.
Hey guys, this is Coach Alberto Nunez. Thanks so much for listening to our show today. Thank you so much for hanging out with us. I wanted to take a moment to remind you guys that we have a giant video library of educational materials at 3dmjvault.com. The Vault is a place where we have organized our best information, paired it up with some of our favorite resources, and shared with all of you guys in one online database. We have courses on contest prep, hypertrophy, posing, fat loss, postseason recovery, and a whole lot more. Most of it is free. Some of it is for purchase to help support this podcast, and we continue adding pieces of updated content to it every couple of months that members always have unlimited access to. Once again, that's 3dmjvault.com, and we really hope you like it.